Good afternoon, everyone. My name is Ryan Kennedy, and I'm faculty with the Institute for Global Tobacco Control, and I would like to welcome you to our Innovations in Tobacco Control lecture series. These lectures welcome key researchers and experts to share ideas, present their work, and spark discussion. I am very excited for today's presenter. Joining us here in person at the Bloomberg School of Public Health is Dr. Thomas Novotny. Dr. Novotny has made tremendous contributions to tobacco control and global health over the course of his career. He dedicated 23 years to the US Public Service, holding critical roles at the CDC and serving as Deputy Assistant Secretary for Health, as well as many other senior roles. Dr. Novotny joined the UC San Francisco Center for Tobacco Control Research and Education, and later co-directed the joint PhD program in global health at San Diego State University and UCSD. Dr. Novotny is a professor emeritus of epidemiology and biostatistics at San Diego State University, and his research explores the complex relationship between tobacco use and its impact on the environment. In our field of tobacco control, this area of research is synonymous with him. He has worked tirelessly to advance this specific area, and his hard work has seen results in advances in policies that are beginning to regulate this tremendously important aspect of tobacco control. In 2010, he founded the Cigarette Butt Pollution Project, tackling a pervasive yet often overlooked consequence of tobacco use. Cigarette butts are, of course, the most common form of litter globally, and these discarded filters contribute to a myriad of issues, including contaminated surface waters and soils, impacts to wildlife, and the introduction of microplastics. Dr. Novotny is also an alumnus of Johns Hopkins at the Bloomberg School of Public Health. Today, he is returning to share a lecture entitled Paddling Upstream to Prevent Tobacco Pollution. For people here in the auditorium today, we'll have the opportunity to spark some of that conversation later. And for folks online that are joining, you'll be able to ask questions using the Q&A box in the Zoom. Please join me in extending a warm welcome to Thomas Novotny.
Thank you for that kind introduction. It's really a pleasure to be back here in Baltimore. I come back periodically, but I sure don't recognize this neighborhood anymore. It's incredible how it's built up. But I do recognize a lot of pictures on the hallway, in the hallway there on the wall. Edith Shainrick and Michael Clagg, who was my advisor and the dean. And it's great to see their faces, and remember them from those days that I had a chance to come here and be a part of this community as well. It's great to be back, and great to be talking to you about this issue, which is near and dear to my heart as an environmental advocate as well as a tobacco control advocate. And I want to talk about tobacco product waste. And I know this sounds like a sort of narrow subject, but it's actually pretty big, bigger than we think, as it says here in my slide. And it's going to be something that has implications across public health, but also into the environmental community. Well, we'll talk a little bit about a treaty that's now being negotiated on plastics that has implications for tobacco product waste as well. So I want to introduce my center. This is a fairly new center at San Diego State University, the Center for Tobacco and the Environment. It's funded by the Tobacco-Related Disease Research Program, which is administered through the UC system, but can be applied in other kinds of academic environments. And that's funded by a tobacco tax that was passed, especially a few years ago, $2 a pack tax increase provided for a lot of research funding and also to set up centers, policy research centers, which we are now part of the UC Tobacco-Related Disease Research Policy Centers. We also have been getting support from NIH and HUD, and more recently with the World Health Organization. I'm working with WHO on a paper right now, a report rather, to help with the implementation of Article 18, which is on the environment of the Framework Convention on Tobacco Control. So the leadership, George Matt, you may know his name from third-hand smoke work, and he and I are sort of the indoor and outdoor environmental concerns for our center, and we have a large number of people involved with chemistry, economics, behavior. So it's a good multidisciplinary operation. And what we've tried to do is look at tobacco as sort of a life cycle of harms. And this has been discussed. We did some work for the World Health Organization's 2022 World No Tobacco Day to really emphasize this life cycle from the growing of tobacco through the manufacturing, the consumption of it, the discarding, and the pollution that comes from that. And so our center is kind of concerned with these last bits of consumption, deposition, and the pollution that comes from that last part of its life cycle. And there's a lot to talk about on that. But mostly I'm going to focus on tobacco product waste today. This is an actual picture taken by a Audubon photographer of a black skimmer feeding his chick a cigarette butt. I mean, this is the kind of environmental advocacy gets people attention. You know, you can show something that affects baby seals, for instance, people pay attention. Well, here at least was a little cute bird, but I think if any of you have done butt cleanups, cigarette product waste cleanups, you realize what kind of broad-based pollutant items these things are. I mean, the cigarette butt is the most common one, of course, but then we've got e-cigarettes. Now we've got roll your own stuff and packages of snus and Zyn now that's coming on. All of this is tobacco product waste. All of it is something that has probably harmful effects on the environment, some worse than others, but the most common one is, of course, cigarette butts. It's the number one piece of trash picked up on any kind of cleanup, actually, urban or beach or environmental, and it's about 30% of all the stuff that's picked up off the beaches. Our friends at the Ocean Conservancy and the group that does the annual International Coastal Cleanup, and that's happened, I think, this month in September, so we'll get some more data. And it's always the number one product. And urban litter assessments, meaning like an audit, it's about 10 to 20% of all the collected stuff by number. Now, it isn't weight, so it's not, generating that much of a weight problem, but it is a number problem, and it still requires, sort of special cleanup things. It's not always easy to just send the machines that sweep up the street litter to take care of this particular problem. So yeah, here's a list of all of the stuff that's picked up in coastal cleanups. They enumerate it, and it's helpful because at least it provides the sort of alert that this is, and it's not just a little problem. It's it's a significant problem, and it's something that you don't notice until you look for it. And usually when I give a talk, everybody goes out and they look at the street. And I just walked up here from the Starbucks this morning. Yeah, it's there all over the place. So what does it mean? Well, the cleanups are really, I think, an important thing in terms of raising the level of attention, but they really don't do any good at all. And that reason for that is that there's so much of this waste, not just, like in the coastal cleanup, they get about 1 million cigarette butts across the world. Well, that's not very much. So we did a bunch of campus butt cleanups at San Diego State a while back when I was still on, teaching, and I was able to reward my students with extra credit for going out to do a butt waste cleanup. So every year at the same time, around Earth Day in April, we send out 50 students to pick up all of the tobacco product waste we can in our 1 square mile campus. And 4 of those years, the first 3 or 4 years were before the campus went smoke-free, and then the next year was a smoke-free campus. So how many do you think we picked up in an hour with 50 students every year? It's about the same, in fact, every year. Somebody give me a guess, a wild guess. 2,000? Nice try. And, I love to show this because, this is California where hardly anybody smokes. And everybody's environmentally conscious, right? Yeah, but it's there. So, that helps to at least set the stage for, understanding that this is, an area where you can maybe work some attention up and some support for an environmental approach to tobacco control. It's not just behavior. It's like, let's think about regulatory approaches, especially when we realize that what we have really is I can do this. Well, anyway, you can read it. It's a cellulose acetate is a non-biodegradable plastic. This is not a petroleum-based plastic. This is a bioplastic. But it is plastic, and it doesn't biodegrade readily. It can, degrade when you step on it over time with, ideal UV and moisture conditions. It'll disperse, but it doesn't really go away. And the filters they accumulate particulates as well as chemicals that then can leach out into the environment, whether the thing acts as a tea bag leaching out, or as a carrier with all the microplastics that have the chemicals that adherent to them leaching into the environment. And people have thought that, especially smokers who discard their things, that it's biodegradable. And biodegradable filters were tried. The industry back in the early 2000s and a little before that had a whole workforce, or rather a consortium of companies and developers to think about how to build a biodegradable filter that was marketable, and they couldn't do it. It was not marketable compared to what the cellulose acetate filter could provide. So, well, how much trash is that? Well, first of all, globally, I think it's important to realize that there are trillions of cigarettes every year that are sold. The Philip Morris data that I got here is 5.6 trillion. The Tobacco Atlas says it's something less than 5, but it's trillions. And so how many are dumped? And how do we know how many are dumped? Well, we don't for sure. There's no surveillance system. What we do know, and what we have, are some data from self-reported surveys of smokers. We have observational studies where people go out and they stand at bus stops and other places and see what the percentage of the people who smoke dump their butts on the street. So somewhere between 25 and 65% of butts that are smoked, based on these surveys and observational studies, are dumped in the environment. So let's say it's 2/3, 4.5 trillion. Maybe it's 2 trillion. Maybe it's 3 trillion. It's trillions. And 95% globally are cellulose acetate. Here in the States, it's 99.8% are cellulose acetate. Each package of cigarette filters, 20 cigarettes, weighs 3.4 grams. And so when you kind of work this out as to the number of that are estimated to be dumped on, you can weigh these and get a metric ton measurement of 765,000. So all the rest of the stuff is also not included in this, but it's there as well, and in some cases growing when it comes to e-cigarettes, for instance. So I want to talk a little more about this filter because the idea is that we'd like to get rid of it. And what does that mean? Because the word filter means that it's doing some good, right? The word itself is a misnomer. It's meant to keep tobacco bits out of cigarette smokers' mouths. And that's where it started back in the 1880s. And we'll talk about the anatomy of it and talk about ventilation, which is also something that people have been studying a lot lately. And about knowledge, attitudes, and beliefs, and the tobacco industry's response to TPW. So yeah, back in the 1860s, there were filters that were used with roll-your-own cigarettes, but they didn't really do anything for filtration. They were mostly, again, keep the tobacco bits out of your mouth. Back in the 1930s and 40s, when some research started on the health consequences of smoking being adverse, there were filters that were starting to be placed, and the first commercial filter was Viceroy in 1936. Health concerns really led to a lot of research, including in the Public Health Service and and government support for research on safer cigarettes. And the evidence on the carcinogens and the adverse health consequences of cigarettes started really to build up in the 1950s. And there were some interesting filters, such as the Kent micronite filter made of asbestos in the 1950s. Were marketed. A lot of other things were used, carbon, and the kinds of things that are into the filters. All of this was in response to the health scare. So if you don't know about these documents, these are the sort of root of our professional lives. The Royal College of Physicians report on smoking and lung cancer, and there's U.S. Surgeon General's report, it was actually 64, on showing the consequences of smoking causally related to smoking, lung cancer, bronchitis, cardiovascular disease. So that then stimulated so much more interest in filters, and this graph shows the growth of filter cigarette sales from the 1950s, where it was like 1%, to the 1990s, where it became almost 100%. And so that is an indicator of how committed the industry and smokers are to a filtered cigarette, and how hard it will be to get rid of it, because it is, a chief marketing tool, of course. So, and the cellulose acetate became the most common kind. And I think it's also important to know is that the tobacco industry doesn't make the filter. Chemical companies make the filter. Eastman, Dow, others. There's like 6 major manufacturers of these things. So that complicates perhaps what might be, they've got partners now from the petroleum industry, from the chemical industry on this that undoubtedly have a vested interest in keeping the cellulose acetate filter in business. It's got fibers, 12 to 15,000 strands, and it forms something called a tow, which is what they glue onto the cigarette, and then glue, the plasticizer within the fibers as well are part of the anatomy of it. I mentioned the degradability that's just not very reliable. There's laboratory studies showing how it can perhaps last over 10 years. One recent study showed that if you grind it up and mix it with, you really sort of address the smoke filter as a compost component. If you put it into a compost pile, it'll take 1.5 years to really degrade, and that there will be biodegradation because it's, it's a organic sort of product. But that means you have to get all of these, if you were to use that as a sort of remedy, you'd have to get all these filters together, make sure you've got a composting system that works, and make sure that they all get into it. But that's not a logical or logistical success story in the making, I don't think. So anyway, it's something that people are focused on. Recycling, we like to have a circular economy, but recycling filters means collecting enough of them to make a difference. An infrastructure of collections and management and storage, and TerraCycle is a company that's tried to do this, and they started out trying to recycle some difficult things like flip-flops and pop tops from cans of beer and things. They worked now with support from the tobacco industry to try to get volunteers to go out and pick up butts and send it to their factory in New Jersey to be recycled into some consumer valuable products. Well, I don't think that's working very well, and I don't think it has the ability to really make a public health difference or even an environmental difference by getting enough of the butts out of the environment. So it's not an option. One other little problem with filters is that these pieces of fiber sometimes end up in the lungs of smokers, and they found this on autopsy reports, for instance. The ventilated filter is something that is, another advancement in trying to make a safe cigarette. It makes it easier to draw the smoke into the lungs, and it reduces the measured tar nicotine on machine measuring. But it's also not something that really works because smokers block the holes, so the delivery becomes probably the same. What might happen, though, is that it's drawn more deeply into the lungs so that it reaches the periphery, where it becomes something more perhaps dangerous when it comes to the cell type that lung cancer that we now understand. That means, that when you inhale more deeply, and if you've got an obstruction to the inhalation that you want to apply to a cigarette, it means you try to get deeper into your lung, the smoke. And what's happened with that over the last 60 years of filtered cigarette smoking is that lung adenocarcinoma has increased. It's replaced the small cell carcinoma cell type that was most common when we first started understanding the health consequences of smoking. So these incidence rates have gone up. So the other cell type incidence rates have gone down, mainly because people have quit smoking. But what they've done is they've switched, the entire population practically to filtered smoking, and so the adenocarcinoma is now the most common, and it's a bit more aggressive, harder to treat. So that makes me think that, well, maybe the filter is not a health benefit, but rather a health hazard. When you start thinking about its impact on the environment and its impact on adenocarcinoma, maybe it needs to be called that instead of a filter. I did mention some of these studies about what smokers know. There's a major knowledge gap, too, that I think is important. I mean, general population, policymakers and smokers, most people don't realize that the cigarette filter is made out of plastic. Most people think that it has some benefit. Young adults are a little less sanguine about this. They knew they were plastic, many of them. This was a survey done of a longitudinal high school student survey that was done by the folks at Stanford. And even Philip Morris has found that their customers thought that cigarette butts were okay to be tossed into the environment and that most of them were not plastic. So, there's a big knowledge gap to correct here that will have to change in order to make any policy work. The environmental impact, excuse me, is a little hard to assess. There's a lot of laboratory studies that have been done recently, looking at the specific toxicity to microorganisms, water fleas, frogs, worms, mollusks, fish. And so we know that it has this impact because of the chemicals, and they're substantial in terms of the, even starting with nicotine as a hazardous product, to metals, to tobacco-specific nitrosamines. And, do they have an effect in the larger sort of ecosystem? Well, we know that there are changes in microbial communities as a result of the impact of these chemicals. Nicotine was a pesticide originally, and it's been banned as a pesticide. And then we have the microplastics, as I mentioned earlier. When these things disperse, they can break down these small particles. So what the definition of microplastics is? Anything less than 5 millimeters, right? That's sort of the cutoff. Cigarette butts themselves are about 20 millimeters, so they're macroplastics, but they do break down into the microplastics. So do they get into the environment? The San Francisco Estuary Institute did a study of runoff waters from the sewers, et cetera, in the Bay Area. And they did find that cellulose acetate was a predominant plastic piece in there. Now, where does cellulose acetate fibers, where do they come from? Well, cigarette butts for sure. Rayon, eyeglasses, photographic film, who uses that anymore, and maybe a few other things. What of those products are going to be tossed into sewers that go into runoff from the surfaces? Nobody's going to toss their clothing into a sewer that much, or nobody's got photographic film anymore, and I wouldn't put my glasses into the sewer. So probably it's cigarettes. So that'll be interesting. So now the state of California is engaged in a microplastic strategy that will hopefully, I'm hoping, because I'm part of this, will recommend that single-use tobacco products that contribute to plastic pollution could be banned. We've tried it 3 times in the state. It's always been subverted by tobacco industry activities, killed in committees. But I'm optimistic that eventually, because of the plastic concern, that it's going to be a much more viable kind of thing. So are there potential pathways to human health risk? And this is an important consideration. We don't really know if this in the larger ecosystem sort of insult by tobacco product waste, is it doing anything to us? Well, we know these chemicals come out. I mean, the leaching is evident, and we can measure it. So the pathways are potential through food chains and through water contamination. And so, yeah, I mean, the possibility, the biologic plausibility, which is one of the key pieces of assessing causality, is there. We have done some studies on whether the chemicals from tobacco product waste can get into the food chain, and indeed they can. And this is, stuff that can lead to estrogenicity, sublethal effects on tumorigenicity, bioaccumulation and biotransformation of some of the toxic chemicals. So in the laboratory, we've been able to demonstrate this in mollusks and fish, rainbow trout. So that potential is there. If you have never read or haven't seen Robert Proctor's book called The Golden Holocaust, it's a great reference book. And he's got a chapter in there called The Filter Flim Flam. And he's great. We had him give a talk on World No Tobacco Day here last May. He's got great stuff on the absurdities of the filter kind of marketing. And he's broken this down clearly into 3 reasons why the filter is there. 1, to lower the cost of manufacturing. It's cheaper to have a cellulose acetate filter than tobacco leaf. So filtered cigarettes have less tobacco than unfiltered cigarettes. So part of the historical risk differential between filtered and unfiltered cigarettes may be because of that, actually. To keep tobacco bits from entering the mouth and to convince people into thinking that filtered brands are somewhat safer. That's the marketing tool that they have been putting forth. And you've seen, in the past advertising, light, low tar, that all is now prohibited. You can't use those terms anymore. But that was certainly, the linkage with filtered cigarettes was light and low tar. And that's what sold cigarettes a lot, I think. Now, what happens when smokers can't smoke filtered cigarettes? This is a key question because, if you have any positive effects from filters, are people going to get sicker? There have been some studies, and, in the past, a lot of studies that thought because of the light and low tar kind of nature of filtered cigarette smoking that was safer. And there were some studies that showed those results. A recent one was published a couple of years ago as a research letter, not a research study. And it used the screening, the longitudinal study of screening for lung cancer in high-risk older smokers. This was a lung cancer screening study to see if CT screening actually would make a difference in their outcomes, which it did, and now CT screening is much more commonly applied as a preventive medicine intervention. But the authors of this little study was a secondary data analysis of smokers 55 and above who had more than a 30 pack year history of smoking. And they didn't adjust for socioeconomic status. And they came up with this study, that a relationship that was 1.5 higher risk of lung cancer in that group than smokers of non-filtered or filtered cigarettes. So that to me was almost irresponsible because that's not a representative group of smokers, not a representative group of population. And it's something that, I think gets in the way of actually trying to say that, this filter is bad for people because it encourages smoking and makes it easier to smoke. So we did a crossover clinical trial of unfiltered cigarettes. We would have really loved to have had like thousands of people in this, and the way, if you're really going to study this, you'd have to get a cohort and follow them over time, and half of them would take filtered cigarettes and half of them smoke unfiltered cigarettes. Then you'd get some solid evidence about the risk, but that's never going to happen. We got 42 smokers to volunteer during COVID to smoke unfiltered cigarettes, and they got free cigarettes and they got paid to be participants in this study. And what we found was that it was a crossover study where we had them smoke the filtered and unfiltered brand, and then they washed out for a while, and then they smoked the filtered and unfiltered band. We crossed over. They were their own controls that way. And we found that they smoked fewer cigarettes per day, didn't like smoking unfiltered cigarettes, but they had no difference in their excreted tobacco-specific nitrosamines, NNAL, and cotinine. It's not very many smokers, and we can't say that there's a big causality here, but this was a proof of principle study, so maybe a larger one could be done. E-cigarettes, of course, now this e-cigarette waste has been considered by the EPA to be hazardous material, meaning it has to be handled specially. So here's a really interesting twist on that, is if a school collects e-cigarettes from all of their students, confiscates them, and maybe picks them up out of the schoolyard, if they have a kilogram or more of this, they become a hazardous waste generator, and they have to be trained to handle hazardous waste and store it and transport it. You know, it's like, what's the value of these things? This picture is a study of that Jeremiah Mock went around schools around the Bay Area and picked up the Juul capsules. The green ones are menthol. You can tell by their color. It's very favorite for high school students. And these are single-use plastic products also, and they have enough nicotine in them to consider them as hazardous waste. There's also the electronic components and the hazardous waste from those, as well as the lithium from the batteries. In the UK, that they've let e-cigarettes become part of their health system. It's encouraged to help people wean themselves from cigarettes. Now they've got a lot of waste from e-cigarettes, and what they're trying to do now is trying to recycle that. So it'll be interesting to see whether that makes any sense. So the industry has now become interested in tobacco product waste. Philip Morris, if you go to their website, it's really worth checking out our World is Not an Ashtray website. And they give some pretty good data, actually, about, again, this study that I mentioned where they actually survey their own customers. And their answer to this is that, well, we've got to get everybody to behave. Don't throw your cigarette butt down. And then let's get a bunch of volunteers to go clean up, like this handsome young guy down here in the picture, our trash from the beaches and from wherever. And that'll solve the problem. And this is what's called downstream approach. And this is where my talk shifts into thinking about what is the upstream approach, because these things are after the fact. And when we're in public health, we want to go upstream, prevent things from happening. So what can we do to prevent this downstream activity? Well, a lot of things. A lot of them have to do with economics. I was involved back in 1993 in trying to figure out what the healthcare cost of smoking was. This was this is the most important thing I did in my life. We had a data set that we could use to figure out what the costs of smoking healthcare consequences were. And it was called the National Medical Expenditure Survey. And we were able to figure this out, and we published in the MMWR in 1993. And the next day after that was before the internet, a lawyer named Dickie Scruggs called me up and said, "We'd like to see what your model was, Tom." And he flew out to California, and we talked to him for a few days, and then he was deputized by Michael Moore of Mississippi to start bringing the MSA, the lawsuits against the tobacco industry, which ended up at the MSA. It's an important thing to cost out things. And so we're trying to do that. I've got a team of environmental economists and some health economists. We're looking at the economic burden of tobacco product waste as a stimulus to get the attention of people at the policymaking level. And it's not just the economic burden of prevention and abatement of this waste, but also other kinds of things. There's fires, there's ingestion, there's drinking water contamination, other kinds of things that we could cost out. But just thinking about abatement would be useful. What we found here then is, or what we figured out is that there's 5 areas where we can look at cost: the prevention and enforcement of current policies, surface abatement, which is all just cleaning up basically, and we can do that with special studies especially, but also looking at sort of proportional estimates of waste in the waste stream. System abatement, which is the stormwater and wastewater systems, disposal, which is landfill and hazardous waste management, and then the unmitigated waste, which is what's out there in the environment that we don't have a good handle on, most of which we don't have if we pick things up, most of it is still going to stay in the environment. So what's happening now is that there have been some efforts at banning the sale of filtered cigarettes as an upstream thing. There have been efforts at putting a litter fee onto packs of cigarettes to address the waste issue. And there's now a UN treaty to end plastic pollution that a group of us, the Stop Tobacco Pollution Alliance, is trying to influence to get cigarette filters named as a specific product that could be eliminated because it's non-essential, widespread, and hazardous. And that is what we're trying to call filters as a single-use plastic. The WHO Framework Convention on Tobacco Control is now trying to address this specifically on Article 18 implementation on tobacco and the environment. And they've actually recommended banning the sales of filtered cigarettes, and now there's a few countries that are thinking about that. State and local microplastics considerations, as I mentioned, banning the sale of tobacco flavors is sort of the same thing as banning the sale of filters. It can be done at the local or state level. It's permitted by the Family Tobacco Prevention of Smoking, the law, the 2010 law. At any rate, anyway, so environmental initiatives are very important in this, and litigation may be important. Right now, I just met with an attorney from the city of Baltimore. They've got a lawsuit against several industries on the basis of public nuisance. And they were able to win lawsuits against the opioid interests as well on public nuisance. And they've now got some other public nuisance law activities going on, but that's the basis for potential lawsuits. I won't go into this. I know we're running short of time now, but the Intergovernmental Negotiating Committee set up by the United Nations Environment Program is in full force, or is in full form right now. The next session is in November, and again, a bunch of us are trying to get the cigarette filter to be included in the text of the treaty itself. So that's happening, we hope. And then, as I mentioned, Baltimore is suing based on the data that Mr. Trash Wheel collects in the Inner Harbor, as well as other data from their waste management streams. And the costs borne by the city are part of this, $32 million. They're also including criminal penalties because it's a criminal, to litter, it's a criminal offense. And they're trying to look at the potential fines that would be attached to what these products do, and punitive damage because of this defective product, and for the good of society and deterrence to bring this lawsuit. So more power to them. They've got a private firm that led this, and they're moving forward. And so in conclusion, I just want to say the salesless acetate filter is a plastic, single-use, toxic waste product. There's a bunch of knowledge gaps that we've got to try to address. It's a fraudulent marketing tool, and advocacy groups from environment and us can join together and do probably a better job than just us alone. And banning the sale of filtered cigarettes is what I really want to see in my lifetime. So there's a couple of references here. We did a paper calling the cigarette filter hazardous to human health and tobacco control last year that summarizes a lot of what I said here today. And then the California Tobacco Control supported us to do a white paper that really gets into the details of all of this stuff that's available online. And then I met this guy in London. So the plastic stuff, I think, is really going to help move this issue forward, and hopefully we'll have some changes in policy that will follow from it. So thank you very much, and I hope we have some time for...
Yes, thank you. We do have some time, and
Good.
I'll get things kicked off. You touched on it a little bit just towards the end, but could you speak more to sort of policy, regulatory domains, the filter, obviously the opportunities for regulating or banning, because in the context of the US, there's so many tiers, and if you have any insights globally as well?
Well, here in the U.S., I mean, the FDA has the authority on, it has national authority on product, manufacturing, and if there are new filters that come through, they have to be approved by the authority, and they have the ability to actually do more than they have done. They have just recently published an interesting article that looked at the environmental justice issues, looking at across the country to show that the waste in underserved communities or highly impacted communities by tobacco use is worse than others. So there's an environmental justice issue, and they've actually pointed this out. And they have the ability to limit, new product development. So like Green Butts and some other groups are making filters that they're going to have to be approved. And if they make a public health claim, I think they're going to have a real hard time getting that approval because it won't work. There's no public health benefit from these. I think the important thing is, here in the U.S. at least, is that the legislation that provides FDA authority specifically permits local and state governments to ban the sale of products. They don't have to change the construction of the product. They can ban the sale of them just as they have with flavors. So that's what I'm hoping happens. On October 8th, I'm going to go to the city council in Santa Cruz, and they're going to be reading, for the first time, their ban on the sale of filtered cigarettes. So it'll be interesting to see how that bunch of surfers up there really got things going on this. And they did. I mean, there's a couple of guys that made a surfboard out of cigarette butts and have gone around the world showing how the impact is on the beaches.
All right. I guess in that context, maybe can you share some of your experiences sort of straddling these different roles, the different constituents, I guess, environmental, maybe surfers, public health. It's a tyranny, and sometimes in academic circles that we tend to be really siloed.
Yeah.
And this seems to be an area where there's just so much opportunity for strategic partnership. It's always hard to work with new partners.
Well, part of it is, again, correcting the information gaps in this. One of the things that has happened, we've been partnered with the Surfrider Foundation, which is an international group. And they go out every month in San Diego and they pick up cigarette butts and other trash off the beaches. And they realize over and over again, it reaccumulates at the same rate. They're there every month. It's the same thing over and over again. And finally they ask themselves, well, what's upstream from this? And I'm reminded of the lesson in our public health courses that we always hear about is where there's a guy standing on the shore and there's bodies floating down the river, and he pulls one out and he does CPR and he feels really good about it. And then he pulls another one out and he goes, CPR on them, and finally somebody thinks, well, what's going on with the bodies floating down from up above here? What can we do to stop that? And so the surf riders now realize that their work, though important because it raises the level of attention, is not going to solve the problem.
What will be some of the responses or arguments that you anticipate the tobacco industry making about some of these anticipated or focused policies? Well,
yeah, it's interesting because they can't say that light and low tar cigarettes are safer. They can imply it, though, and they do that. And I'll never forget the opportunity I had to sit in on a Altria lobbyist who was going after the senator in California, state senator, who had brought this bill to ban the sale of filtered cigarettes, and tried and convinced him that they were doing everything they could to stop selling cigarettes and that they want to change everybody into smoking harm-reduced products. And so leave it to them to do that and not mess with these filters just yet, because that's what's going to happen. That was their argument. So they're shifting. I mean, it's the old whack-a-mole game where they will change the product, they will change their authority, their interventions. But what their main message is right now is that their customers are going to behave because they're going to be warned to, put their butts in the right place and get the volunteers to go out and clean things up. So that's going to be still, I think, continual The industry is funded Keep America Beautiful, Keep Britain Tidy, Keep New Zealand Tidy. They funded all these environmental groups, and that's the way they keep the environmental groups quiet. And so that's changing, though. Oftentimes these groups have dispersed their attention on that. So,
Lauren?
Hi there. Lauren Saplicki. I'm faculty at the School of Public Health here. I was just wondering, the knowledge gap is so profound, even just talking to people about the type of research I do. And so many people don't know that the filter is plastic. And I was just curious your thoughts about using the filter itself as a messenger. I know folks have countries like Canada have started to put health warning labels on, but using the actual filter to change sort of the perception of it, maybe calling it a hazardous waste material, things like that. Any thoughts on that or policies?
That's exactly what we're trying to do, is to really call it out as something that is not there. That article, the one here, Novotny and Hamzai, that's what we tried to do, is say, look, there's no evidence to show that it helps prevent illness. But there's a lot of evidence now that show that it's hazardous to all sorts of creatures, and that it encourages people to smoke. And so, as a result of this is a harmful product. It should be relabeled as such. And whether the FDA will call for labeling of packages or not, it's a little hard. But I think the knowledge gap is getting corrected, but it's a very slow process. I think this whole idea of plastics is what really people will pay attention to. And we just keep calling it a plastic, single-use plastic. It's going to be like a plastic bag. People will accept the fact that it's got a plastics pollution potential and get rid of it. And that's the upstream solution, rather than just informing people about it.
Some questions online. We've talked a lot about the filter in cigarette products, but you also discussed things like electronic devices.
Yeah.
We've got a question online about sort of environmental impacts from smokeless products. A lot of the world, that's the most common form of tobacco use.
Well, the snus pouch is made of cellulose, not cellulose acetate, but cellulose, so it's got more potential for degradation, but it's still out there. I was in Sweden a couple of years ago, and I went around looking for snus packages, and they were all over the place too, just like cigarette butts, more than cigarette butts, in fact. And so, those are another source. And again, when you have things like that, even that degrade a little bit, it's still, the chemicals are there. Right. So when we're dealing with any kind of tobacco product, because of the nicotine especially, that it is, all of this stuff is, would be, in my opinion, hazardous waste. The e-cigarettes in particular, though, have the electronics, the lithium batteries that add all to this, and the disposable ones are now banned in several countries, and I think some states are considering it, like the puff bars and things that are single-use filters.
We've seen some really egregious examples of sort of I don't know if it's greenwashing or marketing, but and this is a question from online as well, some tobacco products are doing things like embedding seeds in products.
Yeah.
Do you have other sort of examples or really egregious activities?
Yeah, that's a good one. They put some, this is in India, I think they put some seeds into the filter so that when you deposit it, it'll have a plant that grows in, take care of the environmental insult that was there. And there's, Green Butts now has a dissolvable filter that, they demonstrate this by showing that, it sits in water for a while and it all disperses. I don't know what the chemicals are, though. I mean, they don't deal with that part of it. And then there's charcoal that has been embedded in filters to increase its efficacy, whatever that means, but yet the charcoal particles have then been found in the lungs of smokers. The most egregious filter ever is probably the asbestos filter that Kent used to sell. So,
and I guess building on some of Lauren's point about knowledge gaps, and you discussed some of the challenges that we have in quantifying or understanding health impacts. What are your hopes, or where do you see sort of the field going and better understanding some of those as we move forward?
Well, I think understanding what plastics do in our body is a big one, because now we know that they're all over the place. And just a few studies have shown like cardiovascular disease has implications for the plastics kind of helping form clots in the vascular system. And so I think that one is a big challenge that but what has to happen also is that we have to be able to identify the actual species of plastics that are there, because that's not an easy thing to do. There's a specialized laboratory procedures that need to be able to be applied to identify the species that are in the environment, and then connect that with anything that's in the human bodies. So that's I think another big issue.
Well, anything other questions from folks in the room?
So I'll go back, Kevin Welding, the Institute for Global Tobacco Control. I'll go back to your economics slide. So I think we often try to use the litter abatement fee around the world when sort of specific tobacco taxes might be at a standstill. And so my question, you're from a multidisciplinary team, it seems. How much collaboration and coordination should we have, tobacco control researchers with environmental researchers? Some of the pushback when we try to do litter abatement fees is there's only so much room for policies to actually pass, and a specific tobacco tax might have a bigger impact. So I guess the question is, is the messenger as important as the message? Should we be working with environmental colleagues to do litter abatement fees and have tobacco control researchers doing something else, or what should we be doing?
Well, I think the environmental colleagues, just in terms of advocacy, again, are really effective, and these are large organizations that have lots of support, and they have come around to think of this issue as an important one. The Sierra Club is a big partner in California with us now. They're actually getting funding from the state health department, so actually putting money into the environmental side of it from health is important. And then on the other side, the state health department has got something called undo.org. If you haven't looked at that, it's worth looking at. They really emphasize the environmental stuff as part of their tobacco control program. So it's become integral on both sides. And I think that makes a big difference, because it's part of the Sierra Club's program, but it's, the environment is now part of the tobacco control program. But of course, California, our prevalence of smoking is down to 6.2%. So it's a lot more easy to stimulate interest along these lines because of the environmental concerns that people have. Part of those are economic. We want clean beaches. All beaches, state beaches now in California, are smoke-free, and that was an environmental intervention. But obviously, it denormalizes tobacco use. And so the environmental denormalization of tobacco use is a critically important thing that we want to try to do. So I think this integration is actually beneficial and logical, And the economic piece always is important. Whether, if you raise the price of cigarettes, we know that works, raising the price no matter what it is, whether it's a litter fee or a tax. But I think applying the funding from that litter fee or from the tax to interventions that can actually make a difference in the environment is not well done yet.
And I'm going to thank Dr. Novotny for coming today and sharing his insight, and sincerely thank you for your talk, but also the contributions you've made to this field over your career.
Thank you.
And thanks for everyone for coming, and of course for folks online. Have a great day.
Appreciate it. Thank you.